Good evening, and it's great to have you with us here as we near the end of another week together. And we begin tonight with the breaking news on the Johnson & Johnson one-shot vaccine here in the U.S. Late today, a CDC panel recommending lifting the pause and restarting vaccinations here in the U.S. with that vaccine. It will now come with a warning about the risk of very rare blood clots. The CDC now revealing there are now 15 known reports of blood clots, possibly linked to the vaccine. That's out of nearly 8 million shots given. 12 of those cases, the clot was near the brain. All of the patients, women between the ages of 18 and 59. 3 of the women did not survive. The panel still determining, though, the benefits outweigh the risks given the millions of shots given out and the rare number of cases, saying Johnson & Johnson's vaccine could still prevent thousands of deaths from the virus as we move forward. And people getting the shot will be told to be aware of symptoms, including severe headache or leg pain, and we'll go down the list. Authorities hoping this will help with some of the vaccine hesitancy, helping to quickly vaccinate people in remote areas of the U.S. Obviously easier because it's just one shot. Only 10 of FEMA's mobile clinics remain operational because of that pause. Tonight, the CDC now reporting more than 135 million adults have received at least one dose of the vaccine, more than 52% now of all adults in the U.S. ABC senior national correspondent Steve Osunsami is at the CDC in Atlanta tonight, leading us off.
It's a decision tonight that health officials say is in the best interest of public health.
The vote is 10 in favor, 4 opposed.
A CDC panel recommends that we should remove the hold on using the single-shot Johnson & Johnson vaccine. Anyone 18 years old or older should feel free to get the shot, and they will be warned about the low risk of blood clots.
Our systems help to identify incredibly rare events. We at the CDC and FDA took the time needed to fully investigate this issue.
Public health authorities put a pause on using the vaccine after 6 women came down with severe blood clots about 2 weeks after getting the shot. Tonight, the CDC shares that there are now 15 of these cases, most of them with severe blood clots near the brain. All of them are women between 18 and 59 years old. 3 of them died, and 7 are still hospitalized. But the experts underline that these are out of 8 million Americans who've gotten the shot with no serious complications.
This is a very rare complication, a very rare adverse event.
The scientists are sharing this table to explain their thinking. Over the next 6 months, they expect to see about 26 more cases of these rare blood clots out of a universe of 9.8 million Johnson & Johnson vaccinations. But they believe the same vaccine will prevent more than 1,400 deaths and keep more than 2,200 people from getting so sick that they need to be treated in intensive care. They're still warning people who've gotten the shot to call their doctors right away if they feel headaches, abdominal or leg pain, or have trouble breathing. 18-year-old Emma Berkey, for example, from Clark County, Nevada, is fighting for her life tonight.
She's been brought out of the coma. She's been taken off the ventilator.
A family spokesperson says she had seizures, blood clots, and needed 3 brain surgeries after getting the Johnson & Johnson vaccine. Doctors say it's not clear if the vaccine is responsible, and her family says they still want Americans to go get vaccinated.
They're not happy with the Johnson & Johnson vaccine, which is understandable, but they do believe that people should get vaccinated.
Many worry it will now be harder to convince many Americans, especially women, to put this vaccine into their arms.
I feel safe taking the Pfizer and Moderna, but probably not the Johnson & Johnson.
Health officials today considered putting a safety warning on the shot specifically for women under 50, but decided against. They say any blood clots are treatable with the right medicines.
So let's get right to Steve Osunsami with us from the CDC tonight. And Steve, how soon could we see the Johnson & Johnson one-shot vaccine available again at vaccination sites across the country?
Well, David, Johnson & Johnson is working with the FDA and the CDC on this right now, trying to get this vaccine back into service. One thing that will speed things along is that there are millions of doses of the Johnson & Johnson vaccine already sitting on shelves, ready to go into arms. David?
All right, Steve Osunsami leading us off here on a Friday night. Steve, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.